Stroke often strikes suddenly out of the blue. When it happens, the symptoms can be mild to severe. When a stroke happens, the symptoms can be very mild, from mild visual blurring or speech disturbance to complete paralysis on one side of the body, and in extreme cases could be with deep coma. When stroke happens, the major key part of the chain of management is recognizing that it is a stroke, and also to reach a hospital that is fully equipped to treat acute stroke. A hospital that is fully equipped should have a priority of scanning patients with stroke within the first 10 to 15 minutes on arrival, which we do in Kauvery Hospital. We have set up a hyperacute stroke unit with specialist team of doctors and nurses. We have treated quite a few patients now in the past 6 months or so who have benefited immensely from the hyperacute time critical management of stroke patients. As soon as a patient comes, they will have a focused neurological assessment and go straight to the CT room, and on the CT table itself we decide the type of stroke that we are facing. It may be a bleed or a clot which is blocking a blood vessel that is starving the brain from oxygen and glucose. If it is a clot induced stroke, mechanical thrombectomy or intravenous thrombolysis is considered. If it is a smaller clot, intravenous thrombolysis, which is being traditionally done around the world, is initiated on the CT table itself, and the patient is transferred to the hyperacute stroke unit. If we see a clot that is larger, starting from the neck vessels, I mean the carotid arteries, all the way to the middle cerebral arteries or the major pipes in the brain, the intravenous thrombolysis will not work efficiently. Studies have shown that they only work in about 20 to 30% of patients. So in that scenario, we will have to bridge it with mechanical thrombectomy, which is done in a cath lab. In the cath lab, we pass special catheters through a keyhole groin puncture through the blood vessel, and the catheter is taken all along the blood vessel through the neck vessel into the brain vessel, and the clot is successfully removed. We have seen dramatic improvements on the cath lab table itself, where the patient started to move their hand and leg and also start talking to us on the table. Most patients who make dramatic recovery often go home within the week's time. There are patients who may not show immediate recovery, but compared to those who never had intravenous or mechanical thrombectomy, they do far better at the end of 3 months of rehabilitation and recuperation. In order to get the full survival benefit and outcomes of a stroke, it is very imperative you are managed by a multidisciplinary team of stroke specialists, intensivists, trained, experienced stroke nurses, and also stroke specific physiotherapist, occupational therapist, and speech therapist. At Kauvery, we have a comprehensive multidisciplinary stroke team which works along with the hyperacute stroke unit. We also have home support where patients who need ongoing rehabilitation can be supported, which helps us to discharge patients much efficiently and faster manner to areas all around Chennai. We can also do telestroke service to hospitals that are not fully equipped with a full-fledged stroke team, and we do provide support and advice on IV thrombolysis. Having said all of this, stroke prevention is a major part of stroke management. Nearly a quarter of patients who have a stroke would have experienced a mini stroke or a TIA, transient ischemic attack, in the week or two prior to having a major stroke. Often these patients are mismanaged or not looked at seriously, and they end up having a major stroke. If we can get hold of those patients in the first instance itself, we can do the right assessments, investigations, and initiate the right treatment, which would prevent a major stroke that is waiting to happen. Maintaining a good lifestyle is always important. The common risk factors that gives a stroke are hypertension, diabetes, especially if they're not properly corrected, smoking and alcohol, and sedentary lifestyle. There are a lot of non-modifiable risk factors like increasing age, risk factors that are inherent to our genes, clotting factors, and certain chronic conditions like rheumatic valvular heart disease or rheumatoid arthritis. Certain cancers can predispose us to have strokes, but they are luckily at a very far lower percentage. But in majority of patients, it can be prevented efficiently by maintaining a better lifestyle, walking at least 45 minutes a day. That will make you to sweat a lot, and also healthy eating and maintaining a good sleep pattern, less stress, knowing relaxation techniques, and so on. If you are known to have diabetes, hypertension, or high cholesterol, it is better to have it checked frequently so that all your risk factors are nicely controlled. We do see a lot of patients who have never been looking after their chronic conditions properly, which predispose them to have a stroke. Smoking, especially in young patients, can block off the main blood vessel that goes to the neck called the carotid artery and lead on to carotid stenosis. And it can also lead to peripheral artery stenosis and foot ulcers and so on. Smoking is a very deadly habit that can lead on to heart attacks and brain attacks. If you are a smoker, please try to quit it, and there are a lot of ways you can achieve it with our help. Alcohol in excess can predispose to premature aging of blood vessels, cholesterol deposition, and calcification of arteries, which should also be controlled. Thank you for listening, and we are also happy to share some of our successful stroke patients' journey through our hyperacute stroke unit, which will be useful for us to help you understand what happens when a stroke patient arrives at Kauvery. So please also refer to a testimony and a live demo of what happens to a stroke patient when they come to hospital, and we will show you how an acute stroke patient is processed in the emergency room, and CT scans and cath lab procedures are being done here. This will help you to understand and make use of our resources in an efficient way. Thank you.